Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning. I'm Dr. Kim Allen Williams, Chair of Medicine here at University of Louisville, and it was my pleasure this morning to have a wonderful endocrinologic and environmental talk. I'm here with Dr. Rob Sargis at University of Illinois and our Chief of Endocrinology, Sri Mashagundam. And we had a wonderful discussion of environmental drivers of disease and the need for clinical action entitled creatively, Metabolic Mayhem. Dr. Sargis, can you give us a 1-minute summary of your talk?
I'd be happy to. So we've shown over the course of the last 15 years that a variety of environmental pollutants are associated with the development of diabetes and other metabolic disorders. Many of these lead to increased risk of diabetes and its associated complications, particularly in vulnerable groups, including those with low income and communities of color. And so when we think about all the risks associated with diabetes, including underlying genetics, diet, activity, oftentimes we're not talking about the environmental drivers that also promote disease development. And with diabetes rates increasing around the globe, it's critically important that environmental factors are taken into account and that we develop public policy and individual interventions to reduce exposure to these chemicals associated with metabolic disease if we're going to stem the tide of the epidemic.
Well, it's really informative, and you're hopefully going to drive some advocacy to try to help with all of the exposures, drive the research, and drive the clinical action. So thank you so much for all your insights.
Thank you so much. I really appreciate it.
And this has been a Cardinal Minute.